Welcome to the live. I do hope that you are here for the attention deficit and hyperactivity disorder video, the ADHD one. Yes, tonight I'm going to spend some time on ADHD. In my profession, I'm a clinical psychologist. I'm also a Christian, and with Matters of the Soul, we try to provide you with a Christian perspective as well as a psychological one. So I'm going to try and do that as an overview um, with uh, with ADHD, and to see if I can give you the picture with the broad strokes tonight, but I'm going to also focus on some details. I will be doing some other videos as well, and some live Q&As that will also happen in the next couple of weeks so that we can talk about this. Now, ADHD is something that we personally know about. We deal with this in our own family. So I have actually thought long and hard about making this video because we personally have it very close to home. But let me share with you what I'm then going to talk about tonight. So I'll be talking about the basic symptoms of ADHD as it presents in children and with adults. And then I'll also be looking at some of the coping strategies, the causes, and the treatment of it. But then there's also some of the difficulties that some Christians or some people have with the medicalization of ADHD and those aspects, and I'll try to give my opinion on that. And there are various positions that people take on this, and I'll give mine as we continue then. So with some of the information that I'm going to share with you, what we will be doing is we will be posting some nice graphics with lots of information in the next couple of days that you can find on our channel, Facebook page. So we'll be posting those with comparisons with children and adults and some of the symptoms that you can find there. And we've also be posted, if you've checked out our Facebook page, Matters of the Soul, Sake van die Siel, you probably saw that we've been posting some coping strategies and those things as well. Thank you, Jessica, for that. So what I'm going to do is just take you through some of the symptoms of ADHD. Now, I think the first question is, what is ADHD? The Diagnostic and Statistical Manual of Mental Disorders number 5 is the American Psychiatric Association's Bible, if you would call it that. There it is seen as a neurodevelopmental disorder. So that means neuro refers to your brain and development. So the development of your brain, and there is a disorder in that regard. So there's a dilemma with the developmental process in the brain, and then how it plays out with regards to the child's development, with regards to thinking and feeling and behavior, concentration, all the normal activities that you might find that the child should go through. And it is then seen almost as a neurological disease. It is found in children, adolescents, and adults. Always in the past, people used to think, no, you only have it as a child and you outgrow it almost. But we have found that there are actually a lot of adults dealing with it. Now, I'll specifically spend some time on ADHD in adults a bit later. But what you want to know here is that there are three main types of ADHD. So we call it ADHD, and then people typically refer to ADD as the inattentive type or the inattention type, which means that there are dilemmas with their attention giving. So that involves concentration. Now, when you have dilemmas with concentration, that is also then your focus. And it's typically how you focus and how long you can concentrate and on what you can concentrate. So when we have the inattentive type, it does not necessarily include the other two types, the hyperactive and impulsive types. So let's have a look, if we continue a bit further with the inattentive type. What we deal with there is, you would find that people typically struggle with giving attention, to their task at hand and what they've got to do, and they lack the persistence to continue with it. They have difficulty sustaining the focus and continuing and finishing a task. They tend to be disorganized, and they struggle. And it's not because they're defiant or they don't understand. It's literally that they struggle to continue attending to something. There is a distinction, however, if they find that they are extremely interested in a subject, there they can actually then move to another kind of attention, and that's hyperfocus. It's where they almost go to the opposite side of focus, and then they have intense focus on a task. Now, when you find the inattentive types, that's usually where it becomes difficult, because it's very disruptive, and not disruptive, it's very difficult when you have to attend to schoolwork and you're a child, or when you're an adult and you have to work at huge projects and you have to give a lot of attention. There people then start struggling, and it really becomes a dilemma. So you can be inattentive but not hyperactive or impulsive. Usually we find that adults struggle with the inattentive type, and girls tend to struggle with more likely with the inattentive type. I neglected to say something, and that is that it is a disorder of executive functioning. When you look at the prefrontal cortex, and I always joke and say that's why I'm bold, is to show you my brain, the part of your brain that works with executive functioning. That's where you do your higher level thinking and problem solving. And this disorder is a dilemma with the higher level of executive functioning. So meaning how you perform those executive tasks of thinking and problem solving and focusing and planning and organizing. The difficulties that they find are with those executive thinking. And it is really hard for them. So when we find the inattentive symptoms, if something is repetitive or boring, then people tend to quickly zone out. And it's especially with children. It's not that they cannot pay attention, it's just that they find it very difficult to stay on track, and they bounce from task to task without completing any of them. They skip the necessary steps when they have to do procedures. They struggle to organize themselves. It's just harder for them than for others. And it can come across as somebody who's lazy, who's not really wanting to do that. A typical teenager's room, as you know, is deurmekaar. But a child with ADHD and an adult sometimes struggle to concentrate on that specific task, and they tend to bounce from this thing to that thing, from this thing to that thing. And they have trouble concentrating on the things around them. They actually need a quiet, calm environment for them to stay focused. If you find a child with these symptoms, they then easily get distracted. So we have found with our child that when she was in school, it was extremely hard and difficult to focus amongst 30 other children or 25 other children to stay focused. There are just too many distractions. Auditory distractions, things that take their sounds and people talking and walking and any kind of thing, especially if it's a boring or not a very particularly pleasant subject. And then they also get bored before the task is finished and they jump to something else. Sometimes there are ways to describe it with like Ferrari brain with bicycle brakes. They just don't have their thought patterns are actually fast. They appear as if they're not listening when you speak to them. They have difficulty remembering things, following through with instructions. If you give them, we found it with our child, if you give them more than 2 tasks to do, and you repeat, or you give 3 or 4 things, please take this and do that and pick up that, and she tends to forget all of them, or maybe one. So there's a difficulty to continue to remember things. And we would talk about working memory. So that's the memory that you use when you keep your mind, when you have to remember a number, and you're running around thinking, oh, this is a number, there's a number. Yes, please send your questions through. What I will do is I will take some time a bit later and answer your questions, especially during the next live Q&A. So executive functioning, it's then trouble staying organized, planning ahead, finishing projects. They've misplaced things, they lose things, books, toys, clothes, all those things. And it's harder for them to organize themselves. So they then easily feel overwhelmed. Therefore, they leave things as is and move to the next thing. It's easier. And so that's very difficult. I must say, it's the other people who look at it seem to, when they look at it, they are like, I mean, come on, just stop this, you are lazy, or what's happening? You're supposed to be able to do this. So it's very frustrating sometimes for other people to deal with this too. When you look at adults, it's also very difficult for adults because they're difficult to focus and to find, if they're focused on something and it's not fully engaging and it doesn't, almost suck them in, they have difficulty to stay focused on mundane tasks, and they then become distracted with other things, especially things that they think should also be done, and then they bounce as well from activities to activities, and they become quite easily bored. And it seems that low priority activities are, easily, they're distracted from them. And things that the distinction between what we would say the general population and people with ADHD is that ADHD people become easily distracted by low priority activities or external events that others tend to ignore. It's important. We tend to, the rest tend to ignore those things, but it's difficult for them. It's like they're screaming for my attention. And you have simultaneous thoughts that are running, and it's difficult to just follow one thought. And there's difficulty paying attention or focusing, especially when reading. They tend to forget because the working memory, keeping memory alive whilst you're doing something else, that's difficult. Or to listen to somebody, to give them their full attention, because there are just so many things happening all at once in their mind. And it can be very frustrating for people who are with that person, because they then end up feeling, but you don't really care in any case. And it's difficulty paying attention, like I said, frequently daydreaming. That's the adult as well, without really even realizing that they're daydreaming. They can even do it in the middle of a conversation. They just, and in these days with technology, a WhatsApp or whatever comes through, and it's like, oh, they're suddenly with the WhatsApp, and you're like, what's up? And then the WhatsApp, and you feel like, what? Just give me your attention. Just stay here. And they struggle to complete tasks, like I said, even the simple ones. Not that they don't have the cognitive or intellectual ability to do it. It's because of the functioning, meaning the processing of that information is the dilemma. So it's almost like the engine is very strong, the intellect is strong, but the rest of the car has some difficulties translating that through the wheels. If I can give a mechanical example, not that I'm a mechanic. In any case, and then they tend to overlook details, and that leads to errors and incomplete work, and these things, especially if they have poor listening skills, it's hard to remember conversations and details and follow directions, and so it becomes a problem, especially at work then, when you have to complete tasks. Now let's look at the second symptom, and that's hyperactivity. I think that's the thing that's the most obvious to people, is hyperactivity. ADHD, it's the H in ADHD. And with children, I mean, you can see that they are quite active children, and they're always moving, and they're trying to do several things at once. They're bouncing, they're all over the place, and they're from one activity to the next. And when those children are younger, I mean, it is hard, especially in a classroom setup where you're expected to sit still and to be quiet. It's very hard for these children, and it's hard for the teachers and the other children. So it's difficult for all people, and you'll find them moving. They call it stimming, stimulating, foot tapping, leg shaking, fingers drumming, whatever. They are busy. But now, how do you if you look at hyperactivity, I mean, they're constantly fidgeting. You know, those fidget toys, we bought those as well. We even bought one of those air cushions where you just cannot sit still on them. So you've got to move. It's because they're squirming all the time and they've got difficulty staying still and playing quietly or relaxing. It's almost like they are more in a hyper or a more stimulated state. They move then around. And if you think of a classroom setup, it's obviously not going to work. It's difficult. And they talk excessively and they have a quick temper. So it's a short fuse. So you have a look at those things. Usually with adults, the hyperactivity is not the main symptom. Like I said, it's the inattention. But you get hyperactivity as well. And it does present itself with adults as well. It becomes more of a restlessness. It may appear as if it's the same, but it isn't. It's high energy, and it's a person who's on the go, as if they're driven by some motor. They can just never sit still. They've got to do things all the time. I wonder if they can watch a movie, without doing 3 other things. They have this inner restlessness, the agitation, racing thoughts, getting bored easily, craving excitement. They tend to take risks as well. They overbook themselves as well with a lot of things. They can talk a lot. They've got a million things that they want to do at once as well. And they obviously have trouble sitting still. But it doesn't mean that if you're not hyperactive, it doesn't mean that you don't have ADHD. So in adults, it also presents this way. But there are other symptoms as well. Then impulsivity, the third one. If you look at impulsivity with children, it's a problem with self-control. So it's a problem with the self-management in that way. They censor themselves less than what other children do. They interrupt conversations. They invade other people's space. They ask irrelevant questions. They inappropriately put up their hands. Oh, they don't even put up their hands. They just scream out the answer, or they ask non-related questions. They will say something random in the middle of a conversation whilst you are talking. They will walk into a conversation when you are talking and just disrupt it and interrupt it. They will make tactless observations. They will bluntly say things, blurt it out, in your face. They'll move into your space. They will almost have a difficulty reading the atmosphere of the room, and then just walk into it and almost clumsily fall over the emotional atmosphere in the room and disrupt it. We have experienced that numerous times, and it becomes frustrating. So they ask overly personal questions, and they say overly personal things. They go too vulnerable too quickly. So they hear things like, be patient, just wait a little while, and it's twice as hard for them. So they have extreme difficulty waiting in lines like you should at a school, sitting still. It's not just the hyperactivity, it's also the impulsivity, which says I have an impulse, an urge to do something, and I struggle to contain the impulse, to say to myself, no, you cannot do this now, you have to wait. And if you're a child and you're in any case struggling with that, because children struggle with self-control, children struggle with temper and emotional reactions. Now, if you have this, then you struggle even more. So they tend to be moody if they're impulsive and overreact emotionally. We just recently had an experience like that. And as a result, they may start to view, other people may start to see that child as disrespectful or weird or needy or in Afrikaans, ongeskik. You don't have manners. And it's hard because they act without thinking. They don't want to take the time to solve this problem. They want to just guess and just jump to a conclusion, and they intrude in games, and they get frustrated with. So they have frustration tolerance problems, to tolerate frustration, to tolerate stress, and they interrupt all the time, and saying the wrong thing at the wrong time. And when they have very strong emotions, it results in anger outbursts, temper tantrums. Sometimes they tend to appear emotionally younger than their age. And now it seems like a very bleak picture that I'm painting at the moment, but hang in there. I do hope there's some hope is coming along as well. Okay, so you've got the three: inattention, hyperactivity, and impulsivity. Those are the three. Now you can have impulsivity without hyperactivity. You can have hyperactivity without the others. The most common one is the combination of the three. Now, some people would say, but wait, how do I know it's not just normal childhood behavior? You know, isn't it just normal for a child to act this way? Come on, why do you have to label them? We're going to talk about that a bit later. What's the difference? Now, the difference is if you spot just a few of these signs, in some situations, then that's not ADHD. That's normal childhood behavior. But if you see a number of them, like a greater number of these signs and symptoms, and they're present across all situations, at home, at school, when they're playing, all across, when it's quiet at night, same kinds of situations, then you tend to say, wait, we've got something more here. It's not just normal childhood behavior. And it's important to then distinguish those two. Yes, I'll look at the debate a bit later. And I want to say, when you are a parent of a child with ADHD, it is hard work. It is really hard work, and it can be very frustrating and overwhelming. But there are things that you can do, and there's hope as well. Because you're going to have daily challenges like you would with normal children, but with this you'll have more. But there are things that you can do. It's not just going to be a hopeless situation. Now let's have a look at some of the different ages. There are, they usually tend to present with these symptoms quite young, at a very young age already. You can even see this at a preschool age. But most likely, some children by 4 or 5, they've learned some of these basic things: to sit still, to stand in queues, to wait. But those with ADHD tend to stand out, and they tend to present those symptoms for way longer. Like I said a bit earlier, with girls, they are less likely, interesting, to be diagnosed and treated for ADHD than boys, and it's similar with autism. But they mistakenly, sometimes they are able to socially adapt and to learn certain coping mechanisms. Sometimes it looks a bit different in girls than in boys, and because they might not seem as hyperactive or in a similar kind of presentation as a boy, or disruptive in class, but sometimes they do. So it's difficult to just generalize, but they may quietly struggle with anxiety and forgetfulness and disorganization and lack of focus, but they tend to compensate for their dilemmas a bit easier, or a bit better, if we can say that, and maybe put some extra work in. The girls are always a bit working harder. Boys tend to be lazy. That's my own generalization. But then they sometimes tend to receive a formal diagnosis a bit later in life. But getting a diagnosis, why is that important? Is it important to get a diagnosis? What are the pros and cons of getting a diagnosis? The debate surrounding the diagnosis is that if you don't get a diagnosis, you may struggle with self-esteem problems, batting your child, expecting them to do certain things in a certain way, like other children would, and you would add pressure. And the diagnosis gives some clarity as to what is going on, and it actually empowers you to say, okay, this is the dilemma. What does the research say? What can I do about it? If you don't get a diagnosis, it sometimes leaves you with some unanswered questions and dilemmas and frustrations, and so it is important, because it helps you to take the stigma out of it as well. It sounds strange, but because now you at least understand that this child is not just naughty and disobedient, and the child actually has something that is that is making it harder. There's a question: is ADHD considered to be a disability? Actually, these days, yes, it's considered to be a disability because it limits certain functions. Does not mean that you cannot learn to deal with some of these things. There aren't hope with this, but it is considered to be a disability. You can actually get additional time on certain tasks and projects and exams, and even some benefits in some of the first world countries. Now, let's have a look at some people would say, but wait, certain, let me look at the causes. What really causes this? Because the causes are also not so clear. I think the majority of medical professionals at the moment think the causes are neurological and genetic, and there tend to be some research on. There's lots of research, but they tend to move towards that area to say, okay, wait, that's we're struggling with a lot of that neurological problems. Those are the origin, and some genetic factors. But the environment also plays a role. There are if you look at the environmental factors, even some toxins that they look at, or some toxins probable, and some nutrition, and exposure to lead. Lots of hypotheses. But if you look at the other videos that I've made, we look at the biopsychosocial model, and I had with some of the other Christian psychologists, we had the spiritual model. Biological, psychological, social, spiritual. The dimensions that you work in. And biological will be neurological and genetic as well. But the other areas all have contributing factors. But it's not as simple as just saying, it's bad parenting that causes this. Or no, it's the social environment. There's not enough structure and discipline, or it's their diet. It's just too much sugar. It's not a very clear picture, but they do know that premature and delivery, low birth weight, birth issues, those all play a role. Stressful pregnancies play a role. Traumatic brain injuries can play a role. Alcohol and drug abuse during pregnancy may play a role. So lots of maybes, but what we do see is there tends to be, we can clearly see, this child struggles with this one doesn't. And you can clearly see the differences. When you're in clinical practice, and I mean, even in our own home, we could see the differences quite very clearly. It wasn't difficult to distinguish. So I think the important thing is there can be other areas or other dilemmas that also could make it a bit more difficult to give an accurate diagnosis of ADHD. So it's important to rule out a number of things like learning disabilities. Some children just have a learning disability with reading and writing and motor skills, language, or there might have been major traumatic events, death of a parent or a loved one, or a serious divorce, and during that time period or after that time period there are dilemmas with impulsivity, hyperactivity, inattention. So you've got to look at all of those things, and maybe some what we call comorbid disorders. Those means other disorders that also play a role in this. Co means that they are co-occurring, like depression, anxiety, bipolar, mood disorders, or substance abuse. We tend to rule out that as well. And then it co-occurs with other things as well, like a conduct disorder, or what they call oppositional defiant disorder. That's children who tend to be very defiant towards authority and discipline and structure and those. And, the other things like a reactive attachment disorder, other medical conditions like thyroid problems, neurological, other conditions like epilepsy, sleep disorder. There are lots of other things that could play a role. In the end, what you do is you take a thorough history and you go through all of these things, and you tend to look at the presentation at home, at school, and in all the contexts where the child functions, and then you make the conclusions. There are certain myths and facts about ADHD. I think the one myth is all kids with ADHD are hyperactive. As I said earlier, that's just not so. Sometimes it's just inattention, and I think those tend to be seen last because they're not so disruptive. and they tend to actually struggle with this for a longer period of time without help. Another myth, kids with ADHD can never pay attention. As we now know, it's not so. They just find something that's repetitive or boring difficult to maintain attention. So whereas the other people would say, okay, now I've got to attend to this, and I can focus, and I can take my attention back here. Here it becomes very difficult to do so because other things tend to vie for my attention. Or there's another one, you will grow out of ADHD. Don't worry about it. When you're an adult, you won't have those problems. What we find is that they tend to grow out of some of the hyperactivity, but not the inattention, or even some impulsivity. Or they tend to grow out of some of those symptoms, but then some of the comorbid disorders like bipolar, mood problems stay. But there are actually a lot of adults struggling with this too. Or that medication is the only option. We'll look at some of the treatment now. But which is not the case. There is a combination treatment that is the best. It's not the best thing to just leave it as is and not help at all. That's to leave it untreated or unhelped. Obviously, is not the best intervention. You need to attend to this child. You need to address these problems so that they can be helped. It is not a quick fix. We don't have quick fixes. We don't have quick solutions that'll just resolve this. It is something where they have to realize the limitations and the dilemmas and then work around it and work with it. Now, I want to just add something. There are positive things about ADHD. Yes, positive. You won't believe it. The one positive, like I said, it does not mean that you lack talent or intelligence. In fact, we find that children with ADHD tend to be highly creative, and adults, imaginative. They can have lots of thoughts, and they can be great problem solvers. They have a huge amount of ideas to solve problems. They can be very inventive and artistic. They can, when they're hyper-focused, they can go into depth with certain aspects and certain subjects. And although they are easily distracted, they can actually notice what other people just don't see. One of our friends is an adult with ADHD, and he's playing according to his strengths. And he's using the weaknesses to get other people to support him there. But the energy and the hyperactivity, in a sense, is driving a lot of action in order to help and bless other people. And then flexibility, because they can consider a lot of options at once. They don't necessarily just become set on one idea early on, and because they're open to different ideas. Now, it's not the same with oppositional defiant disorder and some rigidity. Those you can get resistance. They can be very enthusiastic and spontaneous. Our daughter is cool, has a lot of joy, and she's very spontaneous and loving as well. They're rarely boring. Okay, so they are exciting. They are interested in a lot of different things. They usually have lively personalities, and you've got to also learn to rejoice with that and to see God's design in that as well. That there's a lot of joy. So for me, there was a shift when I was tired by the impulsivity and got frustrated more easily until we actually had a prophetic word to say, but this child brings joy into the house, and I started to notice it more and to see the joy in the spontaneous love and laughter, and that then brought me joy. So the reframe was very good, and it helped. They can be a lot of fun to be with. I know they can be very exasperating too, but they can be a lot of fun as well. And once you learn to accept them like they are, and to love them, and to enjoy what they also bring, that's when you start to almost go with it as well. Now, that does not mean you're not going to give structure and discipline and boundaries and feedback and all those things. No. But there's a less of a judgment that comes, and there's obviously energy and drive, and they can be very motivated to work hard and play hard if they really want to do something. They can actually work extremely hard. And if they have hyper focus on something, it can be actually very difficult to distract them then. and they can be very hands-on and interactive. So those are some of the things that research has also shown. So that is very positive, and I really find it helpful to have that perspective. So we now know that that some of the causes of ADHD, I've just said it can be a lot of different things. I just want to say something about sugar, because now we've dealt with this. We've heard a lot. Oh, you've got to just give less sugar because it's a stimulant. Um, the research has shown that there's not a lot of research that effectively shows sugar to be a causative factor of ADHD. What it can do, obviously, sugar can be a stimulant that can worsen some of the symptoms, but we cannot say ADHD is caused by sugar. So it's difficult there. The research is not conclusive. Now, the skeptics will say, but the research are rigged by the sugar industry. Okay. Um, and then we can say, and obviously excessive sugar intake will have a dilemma with this, and it's not the best for anybody. So, and yes, excessive toxins is not good for anybody. All these things can just worsen it. And what we'd also like to say is, some people would say yes, but then these days it's watching too much television. Those are not causes. Those are, again, it just worsens it. Family stress obviously makes it more difficult, and the traumatic experiences, like I said. So how is it treated? How do you treat this? So again, the biopsychosocial spiritual model. Behavior therapy, I think, is one of the first things that we tend to look at, and that would be uh, giving skills to parents and teachers and the children themselves, strategies, to manage themselves, giving structure to their day, working with a lot of strategies. Now, I'll be posting an article as well from Help Guide that I found very helpful, um, when it looks at some of the practical ways to address ADHD, and especially at school as well. What can you do? But we've got to look at some practical interventions, helping them with routine, with structure, with a quiet environment, with reward systems, with timeouts, with emotionally learning to deal with emotions, naming their emotions, addressing those things. How do I communicate? Developing social skills. That means the ability to address conflict, to handle it. So we actually worked a lot at that as well, as to say, okay, to recognize emotion, to verbalize it, and and to have mutual understanding, even if when she was little, and to learn to calm yourself down, to do self-soothing activities. Um, those are very important. And then the parents also need a lot of skills training, because it can help them to understand what is happening there, and that it's not just willful defiance. It's not just a defiant attitude. It is also a dilemma with managing emotion. So I'm going to give the Christian approach a bit later and some of the controversies there. And then family therapy to help some of the siblings. We also had that deal with the stress, and they also have to understand what the disorder is about and how it plays out. And then also have psychotherapy for the child themselves, where they can learn to talk about their feelings and to address certain behavioral patterns in themselves that are dilemmas, and also learn to manage their stress, to look at their exercise. Even when they're young, they can start to and you can start to address those things, and to try to manage their diet. Now, we found that it was hard to manage that, because it's not so easy to manage the craving for and there is a craving for sugar and for starch. It's because of the stimulant effect, and so obviously you would like try to avoid caffeine as well, as it has risky effects and it's not recommended. And then there are some interventions, like people would say, just give these vitamins. Also, the research is not conclusive on the vitamins or herbs or any of those. I'm not saying they're bad. give them, but it's not a conclusive, yes, that's the answer. Just give them this little bottle here. Just give them this stroopy. That, no, it doesn't really, it doesn't cut it. You've got to have a multi-focus, a biopsychosocial. You've got to address all of the various areas. And omega-3, yes, those things all help. So we threw everything at this disorder. We tried concoctions of herbs and stuff, and in the end, it wasn't so simple. So I think what's important, and then there are also other, medications. Then, so now the big thing is medication. What do you do? What do we say about medication and ADHD? There's a place for medication here. The medication is not bad. And the general, or the medication that we tend to see these days where people give medication is as a methylphenidate. That's the medication has a role to play here. I think this brings me to the medicalization of ADHD, to say, but aren't they just over medicating children now? What is this? Because it is as if everybody, every second child has ADHD these days. Now, let's just take a few steps back here and look at what research does. So what research does is research sees behavioral problems, or they see a dilemma, they start to research it, start to investigate it. And the more you investigate it, the more you realize certain patterns. And that's where theory develops, and you start to say, okay, this is a theory, and so we're looking at this theory, and now we're finding something, and now we're testing the theory. So we test the theory of ADHD, and we go and have a look at all these things there, and then as you start to develop more and more research where you find, but this is a pattern with a lot of other children, that's obviously when you're going to pick up more and more of these cases. So it is expected for you to pick up more cases. If you just bought a white Volkswagen Polo and you drive down the road, suddenly you start to see other white Volkswagen Polos. You've been made aware of it. So obviously there would be more ADHD diagnosis because they've been made aware of it. And now you have a category, you have a name for it. Do some people overdiagnose or misdiagnose and mismedicate, if you can say that? Yes, I think that happens with almost any disorder or disease. But we cannot just dismiss the whole disease just because some people or some medical professionals misdiagnose. So we have to remember that some of the diagnoses are just because we are now we're able to identify it. But this does not mean that medication is now the only treatment available. You have to have a holistic approach. So we were told when our children were young, you can't go with medication, you're changing their personalities, you are suppressing them, they're making zombies of them. The dilemma with the medication is that there are positives and negatives to it. So in the end, if you take the child and you take him through all of the school years, and you say, in the end, what are the positives and negatives of the child having medication and not having medication? What happens is we see that if they don't have medication, there are other struggles that this disorder also brings, and that they elicit lots of rejection from their peers and their teachers, and they struggle academically, they underperform. There are lots of other stress, and their self-esteem is affected. And these things are not said lightly, they are researched. So, and if you look at those negative side effects to the side effects of the medication, eventually we say the side effects of the medication are less. Now, granted, if you're over medicating, if you're giving it too high a doses, then yes, for sure. So there was the whole Ritalin debate, Ritalin being almost like the start of the medication. Medications also develop, and there are certain side effects with certain bodies, because not all of our bodies respond similarly. But you can find, as you work with a medical professional, most of the times the medication work well, and the positive effects are more than they would have been without the medication. So the child is able to inhibit certain responses or reactions. They don't have so many fights with friends and teachers, able to perform better academically, which affects their self-esteem. It is just overall better. Obviously, it remains a personal choice as well. But you've got to not just make a decision on your own without consulting medical professionals. So we had a whole team who worked. We still have a whole team who works with us: psychiatrists, educational psychologists, helping. And even though I'm a psychologist, helping and advising outside of my own perspective. Now, this does not mean that all medications are great and you should just pump these children full of pills. No, use the appropriate medication in the appropriate dosage, and give all of the other areas of support as well. So I think that gives the balance, because in the end there's this picture that the medical fraternity is just making a lot of money out of this. They are obviously making money out of this. But we should, you can you should evaluate, and there in the end it's like you just overriding their moral responsibility by saying it's a disorder. So that's another question. Is it just a disorder that you're overriding their moral responsibility? I think there are two schools here. On the one hand, it's just a medical problem, and the child has almost no control, in a sense, or no responsibility. And then the other side says, no, it's not a medical problem at all. It's just a moral and spiritual problem, and you've just got to work with your character and work with those. I think it's not either or, it's both and more. You've got this medical area here, the medical dilemma, but you've also got a character development that has to happen, and skills training and parental assistance, and you've got to work on all the other things that we all have to deal with, and that's stress management and conflict management. We all have to deal with those things and develop it. But knowing the medical side of it gives you grace, it gives you understanding, and it gives you more tools, because now you realize, it fits there. Immediately when we realized this, it changed the way we approached it. It didn't just resolve it, but it helps if you know somebody has a dilemma with something and it's not just their fault. Yes, can you just excuse them and of all responsibility? Now suddenly they have ADHD, they can do what they want. That's not the case. That's where the moral responsibility does come in, and the training comes in, and the spiritual growth comes in, the character training. Okay, so I think I've given that. So I think it's the both and more picture. It's not the either or, and that I find would give you the balanced approach. Otherwise, there's a distinction and it's not just the parents who are to blame. So it's all over approach. So what do we have to do when you look at? I want to just have a look at some of the Christian perspectives. Or no, let me just first go. I would just want to see if I have covered all of the areas, because I've got a lot of stuff to say. Actually, I see my time's running. There are a lot of parenting tips, and I think I'm going to spend some a separate time with that, because it's just so much to say, and I don't want to just rush over it. And lots of things that you can do as a parent. Some of the basics, let me just touch on those. It does take a lot of energy, and it takes a lot of hard work, and I have empathy personally, sympathy and understanding as well, because it's not easy to get these children to listen, to work with you, to finish a task, to not interrupt, to sit still. I sometimes felt like it was like, working with 3 children at once, and constantly monitoring and managing can be exhausting, and it sometimes might feel like you're not in control of this, and where is it going to end? Are they going to be okay? Now, we have seen the faithfulness of the Lord in helping us day by day, step by step, and it's not been easy. It's not been a known road as well. We still don't really know. We manage it day by day, and we trust the Lord. And it's but what you can do is it's to firstly remove some of the guilt, to say it's not that just you're just a bad parent, but what you can say is, how can I grow as a parent? So that's what we're trying to do, and we've not been perfect with it. We've made mistakes, and actually, that's where you also learn, as by making the mistakes and learning from it. But the children with ADHD, they need structure. They need that routine. They need the certain fixed times to go to bed and fixed times to wake up. And they have trouble falling asleep. Some of them with the hyperactivity and impulsivity, they have trouble. And then people would say, but the medication makes it difficult too. Yes, it does. You get the slow release 12-hour one, but they've got to start to drink it early in the morning. And then we had a natural, medication to help with falling asleep. But we had to manage it stage by stage as well, developmental stages. They also need clear communication. They need repetitive communication. They do need rewards and consequences. They and you need lots of love and support and encouragement. I must say, I think and this is now my own general perspective, that there might be a dilemma in society with a lack of true understanding of what ADHD is. We tended to find that some people they would say, yes, they know it's in ADHD, but I don't really understand that this is a limiting disorder, meaning this is not just a disruptive, naughty child. This child struggles with stuff, and sometimes that child has an inner battle. And it's hard for the parents because there can be judgment as well, judgmental attitudes from others. Yes, sometimes it's not so easy. So you've got to take care of yourself as a parent as well. You and your spouse have to look after your marriage. You have to look after your health. Try to give each other a break. Try to take breaks. Eat right, exercise, do the things, manage your stress, sleep, get support. That's what we also try to do. Try to keep a family routine and a structure. Mondays you do this, so that they have a certain set structure and routine, and try to keep them busy. Try to keep them active as well. So we've looked at all of the interests that our daughter has, and horse riding is one of them. So we've really tried to keep her busy with horse riding and keep them active and simplify their schedule. Don't try to put too much in it, and set clear, simple expectations. Make rules of behavior very simple. I know Hetty Brits has those 5 simple rules for the household from Evergreen Parenting, and explain what will happen when they're obeyed, when they're broken. Follow through with your rewards and consequences. And this is where, we had to remind ourselves that the emotional outbursts were bigger and more frequent and more intense, and it wasn't so easy. So we had to gain skills and how to teach her to contain herself, for us to stay patient, which was not easy, and to try to keep that routine with him. And it's so difficult, because physical activity, we know, manages stress, improves concentration, improves sleep, improves brain growth. We know all of those things. So it assists. Some people have said no, so they've looked at all of the different kinds of sports that child can do, and then encouraged a sport. And then the child you have to try to manage the diet. We try to manage it. It's not so easy. We try and encourage a balanced diet. And then we've also had to try to teach our child to make friends and to manage conflict, which is not easy, because there's really a dilemma sometimes with reading people and reading their behaviors. Also because their focus is not so clear. And there's a dilemma in the social skill, which they then elicit rejection from people. Sure, you've heard a lot of stuff tonight. So I'm going to post a school article for schools from a help guide. That's a great one. But let me look at the Christian perspective now. I know I'm going over an hour now, but please hang in there with me. There are certain perspectives. I've given some of them. Some people would say, no, it's just not like the medical, or it's not medical at all. It's just spiritual, or it's even demonic. I'm not saying that it cannot be demonic. I'm saying not everyone is demonic with this. You've got to also discern there and get guidance from the Lord. Otherwise, you can also cause a lot of dilemmas. But what is the important thing here? That we've got to recognize that it is a medical, a neurological problem. Some disorders like MS Initially, people thought similar things, and now it's proven, so eventually science will catch up with this, and then we'll understand a bit more. But even if it's medical or not, or because when we look at spiritual, the biblical approach, we see the brokenness of the world. We see how we've fallen into sin. The world is broken. We're born into a broken state with a broken body and a broken brain. And some of us have brains that are a bit more broken than others. Broken meaning in the sense that it is not the way that God initially created it to be. So we can expect certain dilemmas. And it's not, living a life of that is godly and that shows a lot of the godly attributes like patience, as opposed to impulsivity and hyperactivity. Focus, hard work, giving your full attention, not being, enduring, persevering. Those are godly attributes that we develop as we work with the Lord and as the Spirit of God works in us. But it's hard for any other person. And for somebody who has a distinct dilemma with this neurologically, it's even more difficult. So we need grace as well, and we need love and understanding. And we know that the Lord says, in 2 Corinthians 12, you can see Paul is talking about the thorn in his flesh, and he's got this weakness that he's battling with. And the Lord says, I'm going to use your weakness and give my strength through it and show myself strong. So this also opens up an area where we are weak, we struggle. Some of us struggle with anxiety, some of us struggle with anger, and we not even have ADHD, or you struggle with depressive thoughts, or you struggle with suicidal thoughts, or you struggle with pride, with over independence, or maybe you're greedy, whatever. All of us have these character dilemmas, and that we're not like Christ there. But those weaknesses make us more dependent on God, as will ADD and ADHD then. And yes, we know that God recognizes that some tasks are hard. But it is good for us to be faithful with what He's given us. And it's not always easy to stay focused. But the Lord works with us, and He helps us to reward us when we focus. There are rewards built in. So people with ADHD just need the assistance to gain that reward so that it will motivate them to stay more focused. And He knows that we tend to struggle to listen. But the Spirit here will help us. But He also helps others in the body of Christ to love and support them. The Lord has given us this body where we're supposed to understand and love. And if we now know, we have knowledge, this person is, let's say, for example, it's easy for us to support somebody who's paralyzed. They've got this paralysis, and then we try and support them to see what they can do about it. We all have understanding for it. We tend to have easy understanding for things that we can see physically. But sometimes when we can't see it, then it's like we lose understanding. We say, but it's not medical, it's not purely medical, so it's laziness. Now, I'm not saying we can't have character flaws associated with this. That's where we say, listen, you've still got to take responsibility. You still have to embrace the fact that yes, you've got sin. You've got to bring it to the Lord. You've got to accept the grace of the Lord through Jesus. You've got to accept the forgiveness of the Lord and surrender to Him and His ways, and ask Him to work with you and with His Spirit. Recently I saw somebody with ADHD as well, adults, and it was difficult because the person's not really acknowledging it, and it's also because of the shame attached to it. So if there's shame put on them, it's very difficult when it comes from outside or even inside themselves to shame them. Now the Lord gives grace, and He helps us. And more so if we understand that this is like a physical disability like paralysis. How can you expect that person who's paralyzed to say, you should walk? Yes, we can trust God to heal me. And we can trust the Lord to heal us. That's also a truth. But then we support that person who's paralyzed. We don't just tell them to, sort out this nonsense. We want to remove the shame from it and the guilt, and to say, okay, you've got the grace of the Lord, so you can take responsibility for what you can do. Work with it, and let's support them as much as possible. And yes, self-control is a fruit of the Spirit. That means it's a fruit that's developed through the power of the Spirit, through the Word and through loving others and through laying down your life and through following the Lord and working with your mind, understanding who you are in Christ and why you were born. All those things are fruits of the Spirit, and understanding your identity in the Lord and subjecting your body, like Paul said, it's a battle. All those things are acknowledged in the Word. For people who don't have ADHD and those who have ADHD, just know they've got a physical dilemma to make it more difficult. But we know that there's grace and there's love, and that the Lord will also help them, and there's also understanding, and that there's value in learning the principles of the Word will become like boundaries in a sense for this person, and to learn to surrender themselves, to learn to ask the Lord to help them. There'll be grace for them too. Like the Lord said, my grace is sufficient for you. But this does not mean that it's not a battle, and that it's not a bit more difficult than it might be for others. Okay, so it's important that we don't just act hastily with saying, but these people are just, you just have to work at your character. It's because it's so close, But we also know that if we want to assist these people, if we want to disciple somebody that has ADHD, we have to know that, like ourselves, we have to develop a servant's heart. We have to learn to serve other people and to do unpleasant things, that we have to be patient. And then the Romans 5 says that through suffering we develop perseverance, and the perseverance leads to character building, and that leads to hope. So if we suffer, that means if you want to go and study something, it's going to take you 5-6 years to finish a degree. Some people 10 or 12 years, but if you study, it's going to be suffering, but you're going to learn through perseverance, through following a plan in which you persevere. You will build character. What is that? That's the character of pushing through, enduring with the difficulty, and in the end you'll gain hope. Yes, I'm going to finish this degree. And it will be similar here, but they'll have difficulty with that, so they end up struggling with the character and the hope then in the end, but then they need assistance. That's where we need to help them with a plan, help them with support, with encouragement, so that they can follow through. It's not just do it, you've got to do it, stop your nonsense. And we're also going to have to walk, that person, the more that person in, and I'm now talking about adults, that the more they soak in the Word and the more they understand, Lord, help me to identify the things I'm struggling with. Am I going into fantasy thinking, like I'm inattentive? What am I struggling with, so that I can add certain scriptures with that as well. There are so many things to say here, but the body of Christ can also embrace these people. And then there's a nice biblical person that I want to just talk about, that I've also found in a nice article, and it's the Apostle Peter. I think gladybranch.org, he mentioned this, that Simon Peter displayed behavior which could be classified as having the symptoms of ADHD. There are impulsiveness in responses to Jesus. He says something, and Peter just rashly says, "Go away from me, Lord," or he acts impulsively sometimes. He even sometimes acts without thinking, takes out his sword and cuts a guy's ear off, or he speaks to the Lord in a brash, impulsive way. No, you can't go and die on the cross. And Jesus addresses that behavior, addresses this, helps there. He even repeats certain behavior, certain actions to him, like 3 times. Repeats something. Could be inattentiveness as well. People then also struggled with it. It's not just a modern problem, it's just that we are more aware of it. But the Lord handled it in interaction. Never was love removed, never was there judgment or condemnation, but there was addressing, and certain rash, harsh, impulsive behaviors were addressed quite strictly sometimes, but always with the kindness and the forgiveness and the grace. So we can see that the Lord was he was communicating to Peter, he was walking with Peter, and he was giving him certain responsibilities, and then also empowering him. So it's not to say that, you know, some of the biblical figures did not also struggle with this. So go and have a look at that. It's not just his temperament, it might have been, but it's just speculative. It's not to say this is the case. Then I've got just another thought. Is it a sin? Is ADHD a sin? Where do we make the distinction? I think the idea here, and John Piper has some nice thoughts on this, is that it's not a sin, but it can cause a weakness that can lead to sinful behaviors. Like all of us would have weak areas where we are more prone to sin. But ADHD in itself isn't a sin, but it can lead to certain areas. So when you are a Christian, you're submitted to the Lord, you're living as a child of God, you've got the Spirit of the Lord, the Word is important for you, then you would have to identify these areas. Where am I prone to sin? Am I prone to sometimes put important things off? Or am I struggling to really listen to my spouse and listen to them more? When you're a child, obviously you're going to act in certain sinful ways. And there's got to be graceful parenting with boundaries and consequences. And that will help. So if we realize that, then we say, okay, so to have a different brain than our structurally have problems is not an act of sin, but it is that we are prone to certain sins. Okay, so I've tried to give you an overview now to say, okay, we've got to learn to love people with ADHD and to assist them step by step to also achieve success. There are lots of people who are managing this and who have professional lives and who have successful lives, who are in ministry, who are making a difference. And as they and their families grow in the knowledge of this and they understand it and they've coupled it with grace and with dependence on the Lord, they actually find that they can I won't say overcome, they can lead successful lives that actually makes a difference. Do they have to manage it every day? I think that's the case, yes. Until the day that the Lord comes back or we go to him, we are going to deal with these battles, and there's going to be that element. But that keeps your eyes on the Lord, and that's what keeps you dependent on him as well, and it helps you to seek him. So using ADHD, and if you've got a child with ADHD, that also does something similar for you as a parent. So helping that child, try to do all of the others, and I'm going to add some more thoughts on this and give you some more articles as well to read. I do hope this helped you and it's given you an overview of what it is and what it is not. God bless you, and go and have a look at our YouTube channel, Matters of the Soul. We've now added the Afrikaans name, Sake van die Siel, and I'm going to have a look there as well for all of the other videos that we have. We've got videos on almost every topic, so go and have a look at boundaries and families as well. That's also something I think would be helpful. And with the Afrikaans videos with Hetty Brits on immergroen ouerskap, some parenting styles and some child temperaments as well that I think would also be useful. That would be another question as well, as where do you see the differences between ADHD and temperaments? We can address that as well. I just thought of the question. Anyway, guys, God bless you, and have a good evening. Goodbye.